The Food and Drug Administration has approved the use of Sinovac vaccine for the elderly. The China-made jab was previously recommended for those aged 18 to 59 only. The health department is reminding families with COVID-infected members to seek medical assistance when using oxygen tanks at home. The DOH also hands out do's and don'ts for those experiencing mild COVID-19 symptoms. The Transportation Department wants all railway staff swabbed after more than 500 train personnel tested positive for COVID-19. And the PNP is reminding local officers to be professional in enforcing curfew and other quarantine rules. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Jess De Los Santos. The Food and Drug Administration has swiftly approved the recommendation of the vaccine expert panel to use Sinovac vaccine on the elderly. Let's discuss that with Dr. Maria Consorcia Quezon of the National Immunization Technical Advisory Group, or NITAG. Doc, will this in any way affect the vaccine rollout, especially now that people with comorbidities are also getting simultaneously inoculated?
Yes, of course, and for the better. Remember that our second group of priority is the senior citizens or the elderly. So we initially we had to say, okay, let's go down to A3 or the third group because we were waiting for the approval. So now that it's approved, or at least the vaccine expert panel has recommended it, then we would be more secure that we can in fact use it for the second priority group, who are the elderly.
Okay, just to, of course, for context here, Coronavac was previously just recommended for those who are aged 18 to 59. What was the basis then for allowing it to be used on senior citizens?
Well, initially, during the first batch that arrived, remember that we are already on the second batch of Sinovac that arrived, right? On the first, sometime January, we didn't have enough data available from all the other researches or studies done. So as new data came in, the experts became more sure that it would be equally effective and can be used for the elderly.
Can you nuance that a bit for us and give us more idea? What exactly does this new set of data show?
The experts look at the interpretation of the data because, you know, data is data and you don't just read it as numbers. You have to interpret, you have to look at all the trials that were made and not only rely on one or two publications, you know. And as of January or February, there weren't enough published articles. It took a while, but now, now that there are more published articles, you know, they're more secure in saying so.
Do we have any idea of the sources of these articles? Because if I'm not mistaken, initially, there were just cited studies from Brazil and China, which were kind of limited when it comes to the use of Sinovac for the elderly.
Yeah. I'm sorry, I'm on the road now and I don't have the data with me. But I guess the better persons to ask would be the expert panel themselves.
Now, based on your knowledge, can the FDA really make such changes when it comes to their authorization for a vaccine?
You know, the thing is, for every batch or for every tranche of vaccines that arrive, you know, there is recommendation, there is a study or the expert panel review whatever is, you know, new studies, new data that come in. So, yes, there is no doubt that they can change, if you call that a change. This is the second tranche that arrived. So, we have new data for it. So, FDA can change, if we call it a change, their recommendation.
Now, how many senior citizens do we hope to actually inoculate via Sinovac vaccines? And is this something that you would say is a compromise, given that there's a thinning supply of AstraZeneca being, of course, the primary vaccine that was initially allowed for use on senior citizens?
You know, we must remember that we do need the vaccine as of the moment because of the surge, right? And so we need to use what is available. And even the available doses right now isn't enough there isn't enough to go around. The estimated number of senior citizens is about 10 million, give or take. You know, so even if we exhaust the 1 million that we have, Sinovac, it's really not enough to cover our senior citizens. So the short answer is yes, it will be useful, and whatever tranche or whatever brand of vaccine comes next, we still follow the priority list that we have.
And lastly now, Doc Conky, the challenge is how do you convince senior citizens that Sinovac is okay for use?
We actually have a demand. You know, there's so many people asking. And there are so many also others who have taken the Sinovac. Even during the first tranche, when they said that it wasn't recommended, there were those who signed waivers because they feel that they need to be protected. And they were comfortable with the Sinovac. So we have examples. So we have people who have been vaccinated. Of course, there's still some vaccine hesitancy, but we believe that there is a demand. And actually, the worry, and the good worry as of the moment, is that there is a demand and we may not be able to supply with what we have now.
At least the level of interest is there. Thank you very much for your time. That was Dr. Maria Consorcio Lim Quizon of NITAG. Thank you, ma'am. With COVID hospital beds getting full, some families with infected members are taking matters into their own hands by purchasing oxygen tanks. The health department says the use of oxygen tanks still requires medical assistance. Shaila Francisco with the story.
As COVID-19 cases continue to rise, more and more customers are scouring for oxygen tanks and refills in different medical supply stores in Santa Cruz, Manila. This forced some like Jason to hop from one shop to another.
Reserba po namin sa pamilya namin kasi nagkakaubusan na po ngayon dito sa Bambang eh. Mabuti na po may stock po kami kaysa wala.
Others like Chal opted to buy oxygen tanks online for her parents.
So yung assurance po nung availability tank tsaka ng refill nagbabago po per day. So every day we look for another place.
Doctors say it might be time for families to purchase their own oxygen tanks as hospitals and COVID hotspots are getting overwhelmed.
For those patients with comorbidities, I would say it's probably not a bad idea kasi nga sobrang challenged ang ating healthcare system. Now, at least no, kung meron silang some kind of recourse within the home, kung kailangan man natin silang abisuhan na pumunta na sa ospital, hindi sila nagmamadali ng sobra-sobra.
But as expected, supplies of oxygen tanks are running low, prompting some sellers to pump up prices by as much as 300 pesos. In Pasig, some supplies are facing delays due to limited stock.
Supplier din po namin, nauubusan na rin po ng supply ng oxygen tank po. Kaya yung iba po, hindi na namin po sila nabibigyan ng ibang oxygen. Itong mga nandito ma'am, puro empty na po yan ma'am. Tsaka yung iba, naka-reserve na po for delivery.
The health department is urging suppliers to regulate the sale of oxygen tanks. To ensure stable supply, the DOH is also asking suppliers to prioritize hospital facilities instead of households. Undersecretary Maria Rosario Vergere says those with oxygen tanks at home still need medical assistance.
Meron po tayong tinatawag na appropriate na level ng oxygen na dapat ibigay sa inyo based on the condition of the patient. And for example, you are not sick and you do not have any respiratory difficulties, difficulty in breathing and all, baka makasama pa to sa inyo kaysa yung nakakabuti, no? Kasi too much oxygen also that we take when we are at that normal or stable condition might also affect our breathing process.
The DOH advises the public to seek a doctor or contact the telemedicine hotline once the oxygen saturation of a patient drops below 94% or if they are experiencing difficulty in breathing. Shaila Francisco, we are One News.
The health department reiterates that those who just started feeling mild symptoms of COVID-19 should not go directly to hospitals. In an interview with 1PHS sa Totoo Lang, Health Undersecretary Maria Rosario Vergeire advised them to isolate at their homes instead. Vergeire reminded them not to panic, avoid taking medicines without the prescription of an expert, and be ready to contact authorities in case the condition worsens. The patients and family members should also know the contact details of their respective LGUs, telemedicine services, and the One Hospital Command. Here are the other stories we're keeping our eyes on. Transportation Secretary Arthur Tugade has ordered the swab testing of all railway workers. This comes after more than 500 personnel of MRT3, PNR, and LRT Lines 1 and 2 tested positive for COVID-19. PNP spokesman Ildebrandi Usana is reminding local officers to be professional in enforcing quarantine protocols. This after the Chief of Police of General Trias Cavite was relieved from his post following the death of a curfew violator who was allegedly forced to perform intense physical exercise. Rights watchdog Amnesty International flags the human rights violations brought about by the government's, quote, harsh quarantine measures. In its latest report, the group cited President Duterte's order to shoot quarantine violators dead during the early days of the lockdown. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website as well, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere.